The following is an article from Health Magazine, our special sleep edition from summer 2023, published by the Southwest Utah Public Health Foundation. Sleepless in Southern Utah, Sleep Disorders and Insomnia. The Centers for Disease Control and Prevention states that a third of U.S. adults report that they usually get less than the recommended amount of sleep. Not getting enough sleep is linked with many chronic diseases and conditions, such as type 2 diabetes, heart disease, obesity, and depression, that threaten our nation's health. Not getting enough sleep can lead to motor vehicle crashes and mistakes at work, which cause a lot of injury and disability each year. Getting enough sleep is not a luxury. It is something people need for good health. Sleep disorders can also increase a person's risk of health problems. However, these disorders can be diagnosed and treated, bringing relief to those who suffer from them. The current percentage of adults in the U.S. getting insufficient sleep, which is less than 7 hours in a 24-hour period, is 32.3%. The percentage in Utah is slightly lower at 30.9%. Some of us are in that category by choice or habit, while others are involuntarily deprived of sleep by medical conditions. We talked to Robert Pearson, MD, at Serenity Sleep Center in Cedar City, Utah, to find out more about sleep disorders and how to treat them. Dr. Pearson is an otolaryngologist and surgeon with over 28 years' experience in the medical field and additional board certification in sleep medicine. How do you become a sleep doctor? Dr. Pearson says, by certification through the Board of Internal Medicine and a 1-year fellowship in sleep medicine. Any doctor that wants to specialize in sleep medicine takes the same test, whether you're an otolaryngologist, pulmonologist, neurologist, or psychiatrist. What is the most common sleep disorder you treat? 90% of sleep issues I deal with are related to sleep apnea, which is abnormal 10-second or longer pauses in breathing during sleep. This results in tiredness during the day and can cause snoring at night. Apnea worsens medical problems like atrial fibrillation, or AFib, high blood pressure, or congestive heart failure. The coexistence of sleep apnea and AFib is very high, so if we treat the apnea, a lot of times the AFib will go away. It's estimated that about 20% of the adult population has some level of sleep apnea. What causes sleep apnea? Most of the time, it's the tongue falling back and obstructing the airway when throat muscles relax during sleep. This is called obstructive sleep apnea and can be influenced by your genetic anatomy, weight, and age. Central sleep apnea is less common and occurs when the brain fails to tell the body to breathe. How is sleep apnea diagnosed? When symptoms suggest apnea, a sleep study is recommended. This is where the patient spends the night in a sleep lab for a polysomnography, which monitors 14 different functions including heart and brain activity, sleep stages, airflow, muscle tone, limb movement, oxygen levels, and respiratory effort. Some people need to take a little bit of medication to help them sleep, although we only need about 2 hours of actual sleep time to determine the presence of sleep apnea. Another option is a home sleep study, which we do a lot of. 2 nights are needed for a home study to get reliable data since it's unattended by staff. The information gathered from a home study is reasonably accurate, although the gold standard is still polysomnography. Unfortunately, the type of test is often determined by what insurance will cover. How is sleep apnea treated? A machine that provides continuous positive airway pressure, or a CPAP, is very effective in treating people with moderate to severe obstructive sleep apnea. A CPAP provides mild air pressure through a hose connected to a mask or nose piece to help you breathe better at night. Although CPAP technology and comfort have improved usage over the years, some people just can't tolerate it. Although not as effective, there is a mandibular advancement device, or MAD, that can be worn at night, which pulls the jaw forward, creating more space in the back of the throat for the airway. There can be some jaw and teeth discomfort, and it's important to involve your dentist to make sure alignment isn't affected. The MAD is considered effective first-line therapy for people with mild to moderate sleep apnea and can work with severe cases as an alternative. There is also a newer surgical implant treatment that has a high efficacy rate for people who can't tolerate a CPAP. A nerve stimulator the size of a pacemaker is inserted in the upper chest under the skin and wired to an electrode in the jaw, which connects to a nerve that moves the tongue. Activated by remote control, the process allows some time to get to sleep, then works by stimulating the tongue to move forward with every breath taken, opening the airway for proper breathing. A patient with central sleep apnea may need to use a BiPAP, which provides pressure for both inhaling and exhaling, similar to a ventilator. What other sleep disorders do you find? Restless leg syndrome can be diagnosed with a sleep study. This is when the legs have uncomfortable sensations with the urge to move them after you lie down to go to bed. A sleep study can also detect REM sleep behavior disorder. While most people are in a natural state of paralysis while dreaming during REM or rapid eye movement stage, this disorder causes verbal and physical responses to dreams, like flailing, kicking, or jumping up. More rare is narcolepsy, or attacks of sleep that come during the day and accompanying cataplexy, which causes muscle weakness when experiencing intense emotions like laughter or anger. Narcolepsy diagnosis needs both a nighttime and daytime study. Sleep bruxism, or nighttime teeth grinding, is primarily handled by dentists, who can observe signs of tooth wear during checkups. Solutions may include a mouth guard worn at night. Bruxism often diminishes if a patient is receiving treatment for apnea. What about insomnia? According to the Mayo Clinic, insomnia is a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. You may still feel tired when you wake up. Insomnia can sap not only your energy level and mood, but also your health, work performance, and quality of life. At some point, many adults experience short-term or acute insomnia, which lasts for days or weeks. It's usually the result of stress or a traumatic event. But some people may have long-term or chronic insomnia that lasts for a month or more. Insomnia may be the primary problem, or it may be associated with other medical conditions or medications. Insomnia is a very common condition, and there are lots of reasons for it. A sleep study does not help diagnose insomnia. We do that based on patient history. It can be a challenge to treat. We can help people understand how sleep works and educate on sleep hygiene. I also recommend keeping a sleep diary. There are medications, but people are variable in their response, and finding one that works is a process of trial and error. There are also side effects and long-term risks of addiction and dementia. I think it's best to use sleep medications intermittently. Just take them on weekends, for example, which prolongs their efficacy and is safer over time. I deal with physiology and surgical issues and treatments, but so much of insomnia is behavioral related. I definitely recommend cognitive behavioral therapy for insomnia, or CBTI. Studies show that this treatment has at least equally positive results as medications without the side effects. A therapist can also discover if the insomnia might be linked to depression, bipolar disorder, PTSD, or other conditions, so I often refer patients to mental health providers. It's hard to find any local therapists that specialize in CBTI, however, and a lot of insurances don't cover it, so I know some patients who find online providers. What's your take on melatonin supplements? Light triggers the production of melatonin in our bodies, which increases throughout the day to a certain level that helps flip the switch to help us fall asleep. Taking a melatonin supplement doesn't work like a sleeping pill. It won't make you drowsy in 20 minutes. Taken earlier, it may help promote sleep by adding to your natural melatonin, but there's a debate that chronic use could actually suppress your body's melatonin, so it's probably best to use it intermittently, although no one actually knows what the right dosage should be. There are other processes and chemical pathways affecting sleep. Narcolepsy is linked to the absence of hypocretin, a chemical that also helps suppress body movements during REM sleep. Adenosine is a sleep-related chemical which is part of a process that is disrupted by caffeine intake. There's a lot we're still trying to work out about the complex world of sleep. What else do you recommend? Stick to a bedtime schedule and avoid a lot of stimulation right before bed, like eating and exercise. Set the mood for sleep with lower lights, use glasses that block blue light from screens, or alter the device's display settings for evening use. Or just read a book as opposed to a screen. Blue light exposure is especially a problem with the younger population, who tend to be on video monitors, computer screens, tablets, and phones later into the evening, stimulating wakefulness. Again, exposure to artificial blue light too late and too often interferes with the production of melatonin, a hormone that facilitates sleep onset. I recommend everyone get off screens at least a couple hours before they go to bed. Apnea, narcolepsy, and insomnia all cause tiredness during the day, but the single most common cause is sleep deprivation. We schedule and occupy ourselves to the point we don't have enough time to get adequate sleep. Our bodies need that 7 to 9 hours of sleep to get the full benefit of all the necessary sleep stages every night. Most people get better sleep when they put on CPAP machines, but when CPAP patients still show only 5 to 6 hours of sleep, it's often because they're simply not going to bed early enough to get the hours in. There's lots of data that shows an increase in health problems and mortality if we don't give ourselves enough sleep. Making sleep a priority has to become a habit. For more information on sleep disorders, including parasomnias like sleepwalking, nightmares, and bedwetting, visit sleepfoundation.org/sleep-disorders. If listening to this article put you to sleep, you're welcome.